I'll quickly give an overview of what we have bundled in this ICU. So here we have an instrument cluster where we have around 5 to 6 medical equipment that can be placed there, and this is the main control console of this. This controls power, air conditioner and air purification here in this console. You can see there is a LCD display which shows current status of the ICU. You can hear the air conditioner humming there. So it's giving fresh filtered air to the cabin, and you can see all around is red color gasket lining. So the patient cabin is completely air sealed. So the patient is getting fresh sterilized air, filtered air into the cabin through the air condition, and then the exhaled air of patient is purified through this particular multi-mode air purifier we have built here. This purifier cleans air in 3 modes: ultraviolet sterilization, ionization and HEPA filter. So it's very effective. You can potentially put a COVID patient inside and walk around this ICU. Plus the other benefit of this design is, even in case of a disaster management or accident management, this will prevent external infection to the patient because it's giving clean and sterilized air, and whatever air inside it comes out sterilized air. So the risk of infection is reduced. So we have patient access ports here. You can open these and my hand directly goes into a arm length long glove, so that you can touch the patient, even feel the pulse through this glove without getting yourself infected in case you have a COVID patient inside. But for normal patients we have normal port doors also which you can open, and because it's a air conditioned and air sealed cabin, what happens is this ICU also reduces the risk of infection in case of accident or disaster management also, because it has controlled. The inside and outside infections do not mix here. Okay, and we have a host of utility drawers here where you can store the medical supplies, medicines, consumables, medical consumables, and we even have a trash bin here. And you have different 3 types of medical waste management in the system. We also have a small stool built in so that people who are not very tall can use this as a utility to get in. And we have a drip hanger here which can be opened up after transport is done, and you can hang up to 6 drips on each side. We also have a oxygen cylinder bay here which can house up to 22 liter oxygen cylinders, metal cylinders you can house, standard hospital cylinders it can house. We have bundled with a small 8 liter cylinder along with this. So we are now going to demonstrate how to insert the patient on this side. Okay? So we have to open, there are 4 doors in this ICU in total. So the bottom door opens like this, and the top door can be suspended using a chain on the top. So till you insert a patient, you can bring in a stretcher or a wheelchair and get 2 people, 2 nurses can actually put the patient inside. Now this is a very scientifically engineered tilt bed that we have built in, and it can be operated even when the box is sealed. We are going to demonstrate the tilt bed. It's a very scientifically designed 4-piece tilt bed. The head end is a normal tilt, but the leg end has a trapezoidal tilt. You can see that from inside the sealed chamber, you can see the tilt operation going up, the head end is going up. Now we will show the leg end. Now this design ensures that the hip of the patient is protected in case of comatic patients. You will not put too much pressure on their hip joint, and the load goes from their knee below. So we are going to show how the head end doors can be operated. There are 2 pins which you have to release, and the top one is loaded with piston. It can stand up like a car bonnet on its own, and the patient can be intubated by a doctor like this. Typically if there is a patient asleep, he can be intubated. So there are several features for the patient comfort also bundled into this. You can see this head end console. There is a head end light which the patient can switch on in case the patient is awake and wants light or wants to read something, he can do that. Or there is a leg end light. This can also be operated from the outside by the nurse or the doctor during examination of the patient. And whenever the patient, because it's a sealed chamber, there is patient cannot shout. It's acoustically sealed chamber. So what happens is he has to call the nurse. He can press this button here, and an alarm keeps beeping like in a typical aircraft, how you call an air hostess. The nurse can come, attend and switch it off from the outside. And we also have 2 mobile charging slots in case the patient is awake. So this mobile charging slots can be used to charge his mobile and keep himself entertained. And most part, there is a medical timer. So we have a medical timer here. So let me use the start here. I can use a start a stopwatch there. So you can see that the time is ticking there. So we can have a start stop in case we are doing any kind of CPR or other activities. We can use a 5 minutes, 20 minutes countdown timer, and it gives a beep once in every half a minute. So it keeps counting down every 30 seconds. It can give a beep down also. This is one of the few features that we have bundled with this ICU at the head end of the patient. This can be used, we call it as a medical timer. On the other side of the ICU, we have 7 catheter ports. So these are self-sealing, dual sealing catheter ports which are custom developed for this product. So what happens is I can push a tube inside and the rubber inside here is self-sealing. So it seals it so that there is no infection exchange between outside and inside, and whenever you pull it out, it will self-seal itself again. So we have a ventilator, portable ventilator that can be placed here. It's a ventilator tray, and there is a ambu bag and other resuscitation equipment we have placed for that also. We thought through everything that you need in an ICU, and then this was designed. We have had input from 16 doctors who are working as intensive care specialists at JSS Hospital, who have seen this product and given feedback before we finalize the design of this product. Through this steel pillar inside the cabin, air conditioned air is supplied to the patient, fresh filtered clean air is supplied to the patient, and this air conditioner, this is the air conditioner unit below. It consumes about 400 watts of electricity, very small and efficient air conditioner for this cabin. And we have this pillar here which sucks out the exhaled air of the patient and feeds it to the air purifier. We also have a suction unit that is integrated into this unit. So the nurse can put a suction pipe through one of these catheter ports and access the patient's nose or mouth through these patient access ports here and suck the phlegm out, and it can get collected here. There are 2 buttons here. One is a momentary suction, other one is a continuous suction. Both are supported here. We have an inbuilt UPS with a 2-hour battery backup for the entire equipment. The UPS is not designed to run the AC. Without air conditioner, the fan will be running, but rest of the equipment, medical equipment, will be running for 7 hours, because all the medical equipment we have chosen have inbuilt 5 hours battery backup on their own. Okay, and here we have a documentation tray and a light which is focused here so that it doesn't disturb the patient if he is sleeping. The nurse can do ICU documentation here, and there is a small tray to store the documentation also below inside this, and this can be stored away.